Then one morning you realize you got out of bed and walked to the bathroom without even really noticing your knee and without rehearsing every moment. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. One of the most common questions after knee replacement begins with a number. It may be 6 weeks, 3 months, 6 months, or 1 year. But the feeling underneath the question is usually the same. Someone looks at the calendar, considers how their knee feels, and wonders why the two don't match. They may say, I'm 6 weeks out, and I thought I'd be walking better by now. Or I'm 3 months out, and the stairs are still harder than I expected. Or I'm close to a year and I'm much better than before surgery, but this still does not feel the way I imagined it would. Those questions are understandable because knee replacement is often described in terms of milestone dates. People hear that 6 weeks is important. They hear that 3 months is also important. They hear that 6 months and a year are definite milestones. And these time points are not meaningless. They're commonly used in research and clinical discussions to describe general patterns of recovery and to help clinicians communicate about typical phases of healing. The problem begins when those time points start to feel like deadlines. By the end of this episode, you'll have a clearer way to understand your progress after knee replacement without relying solely on the calendar to determine how well you're doing. A milestone can be useful as a reference point, but it can become discouraging when it turns into judgment. There's a big difference between saying many people are improving in this window and saying I should already be at a certain place because the calendar says so. The first statement leaves room for the individual. The second one can make someone feel behind even when they're making reasonable progress. A 2025 longitudinal systematic review by Orange and colleagues looked at physical function after total knee arthroplasty across many cohort studies. This type of review is helpful because it does not simply compare one treatment with another. It looks at how people tend to change over time. The authors found that self-reported function improved in a clinically meaningful way by 3 to 6 months after surgery, while performance-based measures showed more variable patterns. They also described a disconnect that many people recognize immediately. Clinical follow-ups often focus on surgical healing, implant position, range of motion, and safety, while patients are also weighing pain relief, walking, sleep, stairs, fatigue, daily activity, and the ability to participate in life again. That difference is meaningful in the real world. Your surgeon may be evaluating healing, implant position, incision status, motion, and safety, while you may be most focused on how your knee is affecting everyday life. At the very same visit, a patient may be thinking, but I still can't walk through the grocery store without getting tired, or I still don't trust my knee on the stairs. Both perspectives can be valid because surgical healing and daily function are related, but they are not identical. The calendar alone cannot capture all of that. At 6 weeks, one person may be walking mostly without a cane and beginning to feel more comfortable at home. Another person may still need an assistive device, and outside the home, they note they need it even more because swelling increases by the afternoon. One person may be sleeping for longer stretches. Another may still be waking up because their knee feels stiff, heavy, or restless at night. One person may feel encouraged by how much easier it is to get in and out of the chair. Another may be frustrated because walking still feels uneven. These experiences are very different, but they can all exist inside a typical 6-week window. At 3 months, the range is still quite wide. Some people are back to golf, travel, or longer community outings, and others are still rebuilding strength, endurance, and confidence with stairs. Some are dealing with swelling that worsens after activity. Some are learning how much walking is helpful and how much is just a little too much for that day, or a lot too much for that day. Some feel very encouraged, and others may still be surprised by how much work the knee replacement process can involve. By 6 months, many people expect the story to be finished. For some, Their knee does feel settled by then. For others, strength, walking endurance, balance, kneeling tolerance, and comfort with higher level activities may still be changing. One of the most common things I've heard from orthopedic surgeons over the years is that recovery after knee replacement often continues for 6 months to a year. That can be a helpful general expectation, but it isn't a countdown clock. Some parts of healing happen earlier, others take longer, and no single date tells the whole story. The orange review I mentioned earlier is useful here because it reminds us that different measures of function do not all move in the same way. How someone rates their own ability may improve differently from how they perform on a timed test, a walking test, or another clinical measure. This is one of the reasons rigid timelines can be misleading. Total knee replacement is not one single process. There are many processes happening together. Your incision heals, swelling changes. Your nervous system is adjusting. Your quadriceps are learning how to activate again. Your hip, ankle, and back may respond to new walking mechanics. You rebuild endurance, balance improves. Confidence with movement develops through repetition. And these pieces are connected, but they do not all improve at the exact same pace. Walking is a perfect example. Many people expect walking to feel natural as soon as pain is reduced, and the new joint is in place. Walking may still feel awkward, uneven, stiff, or tiring. That's one of the reasons I wrote Walking Like Yourself Again after knee replacement, why walking feels awkward, and how people rebuild smooth, confident walking for everyday life. This is part of the Total Knee Success series. The guide was created for people who are maybe a little frustrated by limping, uneven walking, fatigue, stiffness after sitting, or feeling that walking is still not quite right. In the book, I talk through common factors that may contribute to changes in walking, why walking can change from morning to evening, how swelling and fatigue may alter gait, and how many people work toward smoother, more confident walking over time. I'll leave a link in the show notes if you're interested. That walking piece connects directly to today's topic because the calendar may say 3 months, but your walking mechanics and movement patterns may still be changing. Your knee may be less painful, yet your quadriceps may still fatigue pretty quickly. Your range of motion may look good in the clinic, good measurements, yet your stride may shorten when you're tired. You may walk well in your hallway, yet feel guarded on uneven ground. None of that is captured by a simple date. This is why physical therapists consider more than just time since surgery. They watch how you walk in the clinic. They look at how you rise from a chair. They ask, how are you sleeping? How stairs are going? How far you can walk? And what happens after you do more than your usual? They may use patient-reported outcome measures, strength testing, range of motion measurements, balance tasks, and walking assessments because no single measure tells the whole story. Your body is complicated. The lower extremity functional scale is one example of a tool used in orthopedic physical therapy that helps people understand how a person perceives their ability to perform daily activities. A 2024 preliminary study by Rausch and colleagues evaluated a modified version for older adults after total knee arthroplasty and found promising measurement properties, while also being careful to state that more validation is needed. But I really like this kind of work because it reflects a larger clinical idea that meaningful progress is not only about the number of weeks since surgery, though that does give us some information, but it's also about whether real-life activities are becoming more manageable. Another way to look at progress is through daily function. Can you stand at the counter a little longer? Can you walk to the mailbox with less effort? Can you get into the car with less planning? Can you go up the stairs with better control? Or can you carry a light grocery bag without feeling as unsteady? Can you attend a family event and focus more on the people around you than on every step you're taking? Those changes may not arrive in a dramatic way. Often they appear gradually. You may not notice them day by day because you're living inside the process. Then one morning you realize you got out of bed and walked to the bathroom without even really noticing your knee and without rehearsing every moment. Or you realize you went through part of your day without checking your knee every few minutes. Or someone in your family notices that you're moving more like yourself before you notice it. One challenge with rigid expectations is that they can make gradual progress harder to see. Then, If someone believes that by 6 weeks they should be just walking normally, then anything less than that can feel like a failure. And it's not. If someone believes that by 3 months they should be finished with therapy, they may be discouraged when strength work is still needed. If someone believes that 1 year should feel absolutely perfect, they may overlook how far they've come because they're focused on the part that still feels different. Research on total knee rehabilitation also supports the need for individualization. Graeber and colleagues used the Delphi process to develop expert consensus around outpatient rehabilitation visits after total knee arthroplasty, and the discussion reflected what clinicians see every day. Patients have different needs, goals, preferences, and starting points. Studies from large clinical data sets, including work by Minnick and colleagues and Kaplan and colleagues, also show that care guidelines can improve outcomes, but variation between patients still remains. Someone who entered surgery with strong legs, good balance, and an active walking routine has a different starting point than someone who has had years of limited mobility before surgery. Someone with diabetes, back pain, neuropathy, another painful joint like the other knee, or poor sleep may have a different path than someone without those added challenges. This is also why two people can have basically the same surgery in the same month with the same surgeon and still describe very different experiences. One may say, I feel pretty good by 8 weeks, and another may say, 8 weeks was when I finally started to turn a corner. Those stories can both be true, and neither story can serve as a universal rule. One question that often gives more useful information is, what is changing compared to where I started? Maybe your walking distance has increased from one room to the end of the driveway. Maybe you can now stand long enough to make breakfast, and maybe you can go up the stairs with a railing and better rhythm. Maybe you still have swelling, but it settles faster than it did a month ago. Maybe you still limp a bit when you're tired, but you can identify when fatigue is driving it. These are real signs of progress. You might keep a simple note in your phone or on paper during the first several months after surgery. It doesn't need to be long. Once or twice a week, write down something you could do that was easier than before. It may be walking a little farther, sleeping a little longer, getting dressed with less effort, bending your knee more comfortably into the car, or feeling steadier in the kitchen. Those notes can become extremely valuable because our brains often forget how difficult the earliest days were. It's a great way to show your own progress and give yourself feedback. There's also a practical safety piece here. Letting go of rigid timelines does not mean ignoring concerns. If pain is escalating instead of settling, if swelling is severe or sudden, if your calf becomes painful or unusually swollen, if there's warmth or redness that concerns you, if you have shortness of breath or chest pain, if you develop a fever, drainage, or worsening incision concerns, or if you feel unsafe walking. These are examples of symptoms that warrant prompt evaluation by your surgeon or healthcare team, especially if they're new, worsening, or concerning to you. And individual progress does not mean everything is automatically normal. It means the plan should be guided by your presentation, your goals, and your medical team, not by someone else's calendar. And before we close, I want to mention the Total Knee Success Insider newsletter. I share practical information tailored to where you are in your knee replacement process. If you're looking for clear, supportive information that meets where you are, it's a great resource to have alongside the podcast. It's completely free, and you can click the link in the show notes if you'd like to sign up. So when 6 weeks, 3 months, 6 months, or 1 year come up, it may help to hold those dates as reference points rather than final judgments. They're not report cards. They're not verdicts. They're not proof that you are ahead or behind. They are reference points and only helpful when used with clinical judgment and context. The calendar can tell you how long it's been since surgery. It cannot tell you how much strength you lost before surgery. It cannot tell you how your swelling responds to a busy day. It cannot tell you how your balance feels on grass, how your confidence changes on stairs, or how much endurance your body is still rebuilding. Progress is often easier to understand when the lens is wider than a date. In the next episode, we're going to talk about comparing yourself to other knee replacement patients especially when you hear stories from friends, neighbors, family members, or online groups. We'll look at why those comparisons are so tempting, why they're often misleading, and how to choose a better benchmark for your own progress. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.